Hello, I'm Kieran Lynch and welcome to OviCast, the Teagasc Sheep podcast. Each episode we bring you latest insights, advice and technical updates for the sheep industry. Now in our second bonus episode from a recent Let's Talk Sheep webinar, we hear an edited extract from veterinarian Charles Chavasse, who's Area Veterinary Manager with Zoetis. Charles describes what the different Clostridial diseases are and how they affect the animal. He goes on to explain the vaccination process, adding some very useful tips and highlights some of the common pitfalls. We rejoin Charles towards the end of the episode where we take questions submitted by the audience on the night.
Clostridial diseases, they affect both cattle and sheep, and we're obviously going to concentrate more on the sheep side of things. They're caused by toxins that are produced by the Clostridial bacteria, but it's the toxins that cause the damage. And the other problem we have is the fact that the spores that the bacteria come from are naturally found in the soil. They can survive for years. They're very, very resistant or resilient. And the bacteria themselves are actually, can be present in the intestines of healthy animals. So the presence of the bacteria themselves isn't, well, it's not desirable, but it's not the issue. It's the fact that when the bacteria, certain events happen in the animal, mean the bacteria then start producing these toxins, and those events are normally to do with anoxia. So the toxins are frequently follow minor trauma, such as bruising around lambing time, the bruising from castration, but they also can be associated with a change in the diet. And we often see this in very fast-growing lambs. For instance, their diet's changing, and how the bacteria in the intestine, which are naturally in the intestine, how they react can then start producing these toxins. And unfortunately, the toxins almost invariably are fatal. It's they generally, the first sign is a dead animal. And if you look at the names of the diseases, they're names that were dreamt up by pathologists, people like Marissa or in the past. Things like pulpy kidney. I mean, pulpy kidney is called pulpy kidney because if you take the kidney from a lamb that's affected and you hold it under a tap, it just forms into a pulp. Black leg is because you cut into it, it's just the whole tissue has gone black. So, as I say, they're often associated with they are associated with death. That's the problem. Marissa would put up a slide not dissimilar. This is looking at the cause of lambs, and I'm just showing there the Clostridial diseases, and this is the report from 2020, and 12% of them were caused from Clostridial diseases. So they do cause significant. They still cause significant problems. This statement, and I'm going to read it out because it came from the All Ireland Surveillance Report in 2011, and it could be put into the latest one as well. But because unfortunately, this is old news, but Clostridial diseases remain a common diagnosis despite the availability of effective vaccine for ewes, rams, and lambs. Many cases of Clostridial disease are associated with incomplete or non-existent vaccination programs in herds and flocks. So that sort of sums it up in that, we still do see these problems, and yet we do have effective vaccines, and it's one of those conditions where actually vaccination, is generally very, very effective. But we've got to make sure we have a proper program in place. And I started doing the role I'm in now 12 years ago. And I remember being asked to talk about it one year, and then people asked me to talk about it the next year. And I thought, gosh, why am I still talking about this? But the thing is that it is still an issue on farms. So, we still do need to address it because potentially it is preventable. And Marissa actually highlighted this too, but, pulpy kidney is the sort of number one in lambs. And The bacteria is Clostridium perfringens type D, and as I say, it's a normal inhabitant of the gut in most species, but we frequently see it in lambs over a year of age, and it is frequently associated with the best lamb in the group. And speaking from bitter experience, I know that if I don't go and vaccinate my lambs before the June bank holiday, and I forget, I remember in the first week of June because I'll find my best one or two lambs lying dead in the field. So it is, as I say, it's it does occur, but it often occurs to the best looking lamb in the group as well, which is even more frustrating. There are multivalent vaccines, and Covaxin 10. I mean, it actually covers 10 different bacteria, and as I say, the bacteria produce the toxins, and toxins then cause the disease, where it's pulpy kidney, lamb dysentery, black disease. Sordella is one which is is sort of new, in the sense it's new in the last 15, 20 years, and it causes abomascitis. And that's one of the reasons why the vaccines changed from being just it used to be Covaxin 8, and then it was changed to Covaxin 10 to include this Sordella. So that was the reason for adding that to the mix, because we started seeing that becoming an issue. When we're using the vaccines, it's really important to have a primary vaccination course, which consists of 2 doses, not a single dose. You do need to give 2 doses, and you need to give those 4 to 6 weeks apart. And when we're vaccinating sheep with Covaxin 10, it's fairly straightforward. It's a 1 ml dose followed by a 1 ml dose. It's separated by 4 to 6 weeks. Whether it's a lamb or whether it's a hogget or whether it's a ram, it's still the same dose, 1 ml, given under the skin in the side of the neck. And then when the booster comes around, you just need to give them a booster once a year. And again, it's a 1 ml dose at that stage too. And this is really important. We need aseptic injection technique. It's absolutely essential. Unfortunately, if these vaccines are injected in and any dirt gets in there, you can get fairly spectacular abscesses. And these abscesses will mean the vaccine won't work. That's the first thing that happens. But unfortunately, in small lambs, the abscess itself can be fatal, and they can be the sort of size of a large grapefruit. I mean, they're big with a lot of pus in them. But we want to avoid that happening. To avoid that happening, using injector gums, so you can put a bottle on the top here, and then put a needle here, a clean needle here, sterile needle. And I'd be thinking about changing that needle every 15 to 20 sheep that you're injecting, because if any dirt gets picked up, you're going to deliver it from one animal to another. And certainly, if the needle gets dropped or the gun gets dropped for any reason, throw the needle away. Do not economize on that. So when you're getting the vaccine, ask for plenty of needles to make sure that you can do this the process in a very clean aseptic manner. There's also the 2-needle technique, which, as I'm a small flock owner, so I don't generally bother using a gun, and I would use this technique. So what I'm trying to demonstrate here, and I hope you can see my pointer here, is that you can see I'm holding onto one needle, and that's the needle I'm going to use for injecting the sheep. And this sterile needle is put into the bottle at the beginning. So I then draw up my 1 ml dose, and then I go and stick the syringe onto the needle I was holding here, and now I'm ready to inject the sheep. And then I inject the sheep in the side of the neck here. And the importance of this is that if you keep injecting a sheep and then putting it into the bottle, as you're injecting the sheep, there's a possibility you pick up a small amount of dirt that would go into the bottle, and now you've got a whole solution of bacteria and the vaccine, and then you will just be you can get multiple abscesses that way. So and again, that needle can do the whole session because it's sterile, it's not being moved from out of the bottle. But this needle, I'd be again changing it every 15 to 20 sheep. And I'd encourage people to inject on the side of the neck. It's actually a very clean site because there's wool there. So just part the fleece, and the skin is very clean there. Inject them there. I come across people who want to inject them in the axilla, underneath the armpit, and they go to great lengths to turn sheep upside down and get in there. It's not a clean site. It's sort of sweaty and dirty, but also in turning the sheep over, frequently there's muck being fired around the place. So it's much easier, have them in a race, keep them tight, and as I say, just inject them in the side of the neck there, and that keeps it nice and clean. This is just to illustrate why we have a primary vaccination course of 2 injections, because we give the first injection and we start getting an immune response, and the antibodies and the protection builds up, and then it actually starts to wane. But if we then step in with a second shot, any period from the top of this curve to just about here, which is about 4 to 6 weeks, you then get this much, much bigger response, a secondary response. And that's because of the memory from the first one. And that's what then gives you the protection for the full 12 months. If you only give one dose, you barely reach the levels of protective immunity. And if you do, you're fairly quickly tailing off to where you've not got protection. So it is essential that you give them 2 doses, but it's also important that they're separated with 4 to 6 weeks. If you give it too early, you don't get the big boost. If you give it too late, the memory has been lost, okay? And once you've got that second response, we then find that we only have to do the booster once a year. But this is important, and it goes back to that comment at the beginning. We've got effective vaccines, but sometimes we don't have complete vaccine courses, i.e. we just give them 1 injection, or they're given at appropriate times. So we give them 1 injection and the other injection happens 4 or 5 months later. That won't work, okay? So, or people just forget to do it all together. So it's important it's done at the right time. And the right time, actually, I'll just go back there. I suppose the right timing, again, it does get sort of quite critical with lambs as to when you give it, because one of the advantages of giving the yolk a vaccination is the fact that, yes, you're going to protect the yolk, but also those lambs, say she's carrying twins, which we hope she will be carrying twins, those lambs will be born with no immunity, but then by giving them the colostrum, they then get lots of immunity from having had the antibodies from the mother, from the dam, and that then protects them. But that immunity will wane. In time, that immunity will drop off. And what we've got to do, if we go in and vaccinate too early, then there's a possibility that the antibodies will interfere with the antibodies they got from the mother will interfere with the vaccination process. But if you wait until, say, your youngest lamb's about 4 weeks of age, it's not a bad time to do it, because then your oldest lamb is going to be sort of will be sort of 4 weeks older than that, so will be about 8 weeks of age. And about that time, their natural, the immunity they get from the mother will be starting to wear off. So, the lambs will be aged between 4 to, say, 8 to 10 weeks of age. Then that's a good time to step in and give them their first shot. And then you need to give them the second shot a month later. So sort of pulling it together from a practical point of view, I would recommend that a booster for all sheep is given on the farm, 1 month pre-lambing. So all the ewes who are lining up to lamb, about a month before you start lambing, give them their booster shot. And I did that back there in the middle of January, because I'm going to start in the middle of February lambing. I also brought my 2 rams in and gave them their booster, because I'm a small farmer. I'm not going to buy a special vaccine for the rams, so I just brought the rams in too. And I've also got some yo lambs which aren't in lamb, but they will be bred next year. So I also gave them their booster as well. So the whole flock got the booster a month pre-lambing, and I would suggest that's a good time that everything on the farm gets their booster. As I said, the primary vaccination for lambs, for the first time the lambs get it, if they're somewhere between 4 and 12 weeks of age. So if when your youngest lamb is 4 weeks of age, well, if you've got 2 flocks, you've got an early flock and a late flock, you're going to have to do this process twice. But, sometime between the ages of 4 and 12 weeks, give them their first shot, and then they get their second shot 4 to 6 weeks later. So just mark it on the phone, put a reminder in. If you're doing it there on the, if you're doing it, say, on the 1st of May, put a reminder to go in there on the 1st of June. And that will then give them protection basically for 12 months. I know I'm a vet, and the trouble about vets, we all see problems. And I'm also a farmer. I don't trust anyone to vaccinate my sheep. I don't, if I'm buying sheep in, I would always vaccinate them. It's just too costly, a mistake to not vaccinate them. So when I'm buying rams in, which is the only animals I do buy in, because I breed my own replacements, but I would basically, when the rams come in, I give them 2 doses, 4 to 6 weeks apart. And because you're spending, even though it's out of season, I won't have a bottle open. I would just get the smallest bottle I can get there, and I'd use that bottle to do them. I spend a lot of money on the rams. What's sort of 20 or 30 euros for the vaccine? It's nothing compared to losing to losing a ram. And if you're buying in hoggets, which a lot of people would buy in hoggets, which is fair enough. When they come onto the farm, I'd give them 2 doses, 4 to 6 weeks apart. So that's going to be before they go to rams. So it's probably going to be sometime in August, September time. But then I'd also give them their booster 1 month pre-lambing. So they fall into this category here. By getting all the sheep done here, there's a good chance that sheep aren't going to be left out. So the take-home messages, they are a common disease of death in lambs. Marissa's figures there and the figures I put up there, about 12% of the lambs that turn up in the lab are caused by Clostridial diseases. And in fairness, they are, it is preventable by using vaccination. But the vaccination, you do well to use, one of these multivalent vaccines. So, Covaxin 10, as I say, the 10 sort of that tells you how many diseases are being covered there. And, the schedule is always 2 injections at the start for the primary course, separated by 4 to 6 weeks apart. And then it's an annual booster thereafter. And, I think the annual booster, you get that to fall, a month pre-lambing. That's a simple way to do it. It means that the yolks are well covered. And it also means that they've got high levels of antibodies in the colostrum for the lambs. So that's me. I'm going to stop sharing and quite happy to take some questions, Kieran, or I'll let you feel the way with the questions.
That's perfect, Charles. Appreciate that. There's 2 quick questions coming in for you. One is kind of around if you had used, we'll say, Covaxin 8 or that previously and now have to switch up to Covaxin 9. Obviously, maybe Sordelli is an issue. Do you have to go through the whole process, the primary dose, the secondary dose?
You're no worse off just boosting with the Covaxin 10 in the sense that the 8 that were there before have been boosted okay, but you're right, because the Sordelli won't be boosted okay. Now, in fairness, your lambs who will have got 2 shots of the Covaxin 10 will be covered for Sordelli, so they're covered for everything. So I think what I would probably be saying to people, if you're just moving from Covaxin 8 to Covaxin 10 because Covaxin 8 is no longer available, I would just be making that move. And in time, your whole of your flock will be properly vaccinated as the older animals are culled for various reasons. If, on the other hand, Marissa, or for one reason or another, you've got Sordelli in the farm, then you've got an issue there, then in fact, you should give them a primary course with 2 shots of the Covaxin 10. So if there's been a problem, you've sent the lamb, the the hogget, the whatever, to the lab, and you've come up with Sordelli, then I think you're going to have to give them a primary shot of 2 shots of Covaxin 10. But if, on the other hand, you're just transitioning from Covaxin 8, which you've maybe been using for the last 20 or 30 years, then all you need to do is just slip in the Covaxin 10 and work away from there, because you'll be no worse off than you were before when you were on the Covaxin 8 anyway. And in time, your flock will move naturally onto the Covaxin 10.
Just one quick one, Charles. In terms of troubleshooting, like a lot of that, we're dependent on passive transfer. So we're dependent on adequate amounts of colostrum and good quality colostrum going into that lamb. In certain circumstances, multiple litters, maybe artificial colostrum is used. I think we need to be very conscious maybe that they're not getting any of that passive transfer. It is really vital that they get some element of the O's colostrum.
Absolutely. I mean, colostrum is the most valuable thing on any farm. It is absolutely priceless. And, I think you may have had a talk earlier on about feeding yolks. I mean, that's really critical, that if the yolks are in good body condition, even when they're carrying triplets, you should still get reasonable amount of colostrum. But really, if you've scanned and you've got a load of singles, a single, okay, it's unfortunate she's not carrying a twin. Well, hang on a minute though. Let's be stripping that, in those, particularly if those singles lamb early, I'd be stripping them out and freezing a couple of 100 mils for another lamb when the triplets come along. But, it is absolutely priceless, and your own colostrum is what you want. I must confess, I have very little mass in artificial colostrum. And I really say that every sheep farm, and I know myself, I've got colostrum left over from last year. Okay, it's in the freezer. That is still good. Okay, if it's been frozen for a year, it is still good. Be careful how you thaw it out. Don't be using the microwave now. Be patient. Okay, warm water. You should be able to put your hand into it and keep your hand in there. It doesn't want. If it's too hot, you're going to denature the colostrum. Okay, but I would have some. I've got some stuck away. But to be honest with you, as soon as I get a single, I'm stripping it out and I'm storing it. And I'd encourage everyone else to have. I mean, I used to use plastic cups, to be honest, to do it, and I've got a constant supply there. Now, if you do get caught and you have to go down that route of using the artificial, fair enough. But remember, you're right. You're not getting any protection in there at all with those lambs, and it probably is worth marking them. And you can effectively vaccinate them earlier, but you're on the back foot all the way, because it's not just about the antibodies, because the energy levels aren't the same there at all. But
even some robbing off a very freshly lambed, Joe won the lamb earlier that day. It's still better than just going in blankly with just artificial. Yeah, absolutely.
Okay. I remember on one of these sort of talks talking to Michael Diskin coming up and saying the most useful thing he thinks on a most useful bit of equipment on a sheep farm is a syringe and a stomach tube. And I must confess, I'd be a big advocate of that, because you just need to make sure they get colostrum. And it's the same for cattle too, but I mean, it just makes your life easy. If you don't get that bit right, with hygiene and good colostrum, if you've got good hygiene and you're wearing gloves actually for your own benefit, you're also wearing for the animal's benefit too. But I mean, if you've got gloves, hygiene, and colostrum, jeepers, you're 9/10 of the way there. It doesn't have to get much more clever than that.
Charles, for somebody on the Covaxin 10 program, maybe the lambing spread we're looking at over 6 weeks. How close to lambing should that person go? And I suppose whether kind of looking at that is towards the tail end, is that still going to be sufficient?
It will be. It depends how big your flock is and how accurate you're at, if you know who's going to lamb at what point. And the thing is, because the thing is, if you've say got a 6-week lambing period and you lamb 4 weeks before the first one, then it's 10 weeks to the last one. Okay. I'd say you'd still be okay there. 2 months would be what I'd probably normally say. It would be 2 months would be what I'd like, if you understand me. But because the immunity will have dropped, but it's not going to drop that much, in that period. You're still going to get good protective immunity there. So a 6-week lambing, I wouldn't be actually that worried. But I'm more thinking about people who have an early lambing flock, maybe in January, and then have a flock that's lambing in March. No, they're two different flocks. They definitely would want to have two different attempts there on doing that. I suppose that's what I would say there.
I suppose maybe in the case if there was a split lambing and significant numbers for say for a ewe lamb flock lambing later, it could be worth looking at splitting that.
Yeah.
Okay. Another one just in on that. Any issue given the Clostridial vaccine and the fluticide at the one gathering?
No, you'd be okay with that. I mean, when you're using a single vaccine like that with a worm dose, working on, one's effectively a chemical, and the other one's stimulating the immune system. So I wouldn't be concerned about that. So you'd be safe enough doing that. Yes.
Okay. And just similar enough on that vein, like if sheep are being transported home before from winter grazing, for instance, and just been housed, any issue given that to them on a day where they've been transported, or there's some other stress around handling? Obviously, look, you want to be as careful as possible at that stage, but would that cause an issue?
Yeah, just be careful on the stress thing. I mean, remember, the thing about an animal that's stressed is the fact that its immune system is therefore not functioning as well. So if it's been a long haul, then actually it would be definitely worth turning them into a paddock handy and pull them in, say, 24, 48 hours later. Because remember, with a vaccine or with vaccination, it doesn't matter whether we're talking about Clostridial or any other vaccine. It's basically the vaccine stimulates the animal's immune system. So you can have a perfectly effective vaccine, but if you've got an immune system that's compromised for one reason or another, then you're not going to get a great response. So, I don't suppose it sits so much as sheep. But like, for instance, calves, sometimes people want to vaccinate animals at the same time as disbudding them because it's kind of handy, No, it's not a good idea. We need to basically, ideally, the vaccination should probably go in 2 weeks before they're disbudded, or if for some reason there's a reason for, or 2 weeks after. But basically, those stressful events shouldn't be combined with vaccination.
I think you touched on something very important. The sheep needs to be in good health. So sheep that are suffering from fluke or that, you're not going to get that same level of response. Yeah,
that's true too. Absolutely. No, very good point, Kieran. Yeah.
We're going to leave it there for this episode. I'd like to thank Charles again for giving up his time to come on the webinar with us. A full recording of the webinar with both Charles and Marissa is available on the Teagasc YouTube channel. That's it for me for this episode. Again, for updates on our sheep program, keep an eye on our Twitter page at Teagasc Sheep. I'm Kieran Lynch. Thanks for joining us. Don't forget to subscribe and tune in to future episodes.